Miliary tuberculosis is a form of tuberculosis that is characterized by a wide dissemination into the human body and by the tiny size of the lesions. Its name comes from a distinctive pattern seen on a chest radiograph of many tiny spots distributed throughout the lung fields with the appearance similar to millet seed saguro, thus the term miliary tuberculosis. Miliary TB may infect any number of organs, including the lungs, liver, and spleen. Miliary tuberculosis is present in about 2% of all reported cases of tuberculosis and accounts for up to 20% of all extra-pulmonary tuberculosis cases. Etiology: miliary tuberculosis is a form of tuberculosis that is the result of Mycobacterium tuberculosis traveling to extrapulmonary organs, such as the liver, spleen and kidneys. Although it is well understood that the bacteria spread from the pulmonary system to the lymphatic system and eventually the bloodstream, the mechanism by which this occurs is not well understood. One proposed mechanism is that tuberculous infection in the lungs results in erosion of the epithelial layer of alveolar cells and the spread of infection into a pulmonary vein. Once the bacteria reach the left side of the heart and enter the systemic circulation, they may multiply and infect extrapulmonary organs. Once infected, the cell-mediated immune response is activated. The infected sites become surrounded by macrophages which form granuloma, giving the typical appearance of miliary tuberculosis. Alternatively, the bacteria may attack the cells lining the alveoli and enter the lymph node, S. The bacteria then drain into a systemic vein and eventually reach the right side of the heart. From the right side of the heart, the bacteria may seed a uro, or reseed as the case may be uro the lungs, causing the eponymous miliary appearance. Signs and symptoms. Patient with miliary tuberculosis range from experiencing non-specific signs. Miliary tuberculosis can also present with enlarged liver, enlarged spleen, inflammation of the pancreas,